Now let's talk about atrial fibrillation. This is a cardiac arrhythmia and results in an irregular pulse, and the diagnosis is usually made by the ECG. There are bumps before the QRS complexes, but they are not organized and are random and occur at irregular rates, so there's no pattern whatsoever. Some QRS complexes are closer together and some are not, as well as an absence of clearly defined P waves. Now, normally, the SA node is a generator of electrical impulse, but in atrial fibrillation, there are multiple locations in the atria from which the electrical impulse is being generated, and that is why we see such an irregular pattern on an ECG, as some of them depolarize and generate a QRS complex, while others occurring during the refractory period do not generate a complex at all. Now, talking about atrial flutter, this is another cardiac arrhythmia that has many similarities to atrial fibrillation in terms of symptoms and treatments, but the main distinction is from the ECG. There is a sawtooth pattern before the QRS complex, which are called flutter waves. What you should know about the atrial flutter is that the electrical activity is more organized than in atrial fibrillation, and that is the key difference that may be noted on an ECG. The sawtooth waves or flutter waves are caused by the continuous wave of electricity that goes round and round in the atria that can sometimes go on to generate a QRS complex. So just to emphasize for your exams, if you want to differentiate between an atrial flutter and atrial fibrillation, just remember that the main difference is that the RR intervals in the atrial fibrillation occur irregularly and are regular in atrial flutter. On an ECG, it will be easy to recognize the sawtooth flutter waves and also appreciate the rhythm. Now, in ventricular fibrillation, this is a completely erratic rhythm that has no identifiable waves whatsoever. This is extremely dangerous as it is a fatal arrhythmia and causes sudden death without immediate CPR and defibrillation.